This conference will now be recorded.
All right. Good evening and welcome to the Dunamis Insurance and Business Services seminar, online seminar. Healthcare planning is not just for the elderly. Thank you for joining us for this particular seminar. This is in the middle of a series of seminars that we're doing on the subject. We hope that the information that you share or that we share will be beneficial to you and that you can actually use this information in your family's planning as you look forward to planning for future health care and also your current health care for your family and individuals in your family line. Listen, um, I just want to give you a little word or a little information on myself. Again, my name is Harvey Burnett. I am the owner and sole proprietor of Dunamis Insurance and Business Services, a small insurance planning firm that has been in existence for about the last 20 years or so. And actually, I've been in the industry probably about 25 to 27 years. And we exist to serve the public in a variety of offerings of basic life, health insurance, disability insurance, annuities, long term care insurance, also annuities, retirement rollovers, transfers, estate planning, and also business setup funding, probate avoidance strategies and schemes, and different things along those lines. Basically, we're a firm that's small enough to know you, but big enough to help you. We're contracted with multiple top rated insurers, life insurance companies all over the country, and have good relationships with those companies and a very good relationship in the industry. So that's just a little bit of information on you. Now, what brings me to this, or on me? Now, what brings me to this particular seminar this evening is quite frankly simple. I've been in the business, like I said, for quite a number of years on my own, written quite a bit of long term care insurance over the years. But recently, a particular situation arose that involved me personally. And when I say involved me personally, my family member, my wife, was recently, had to went through a sickness and had to go through a process there of healing and recovery. And during that particular time, I started thinking it was just one or two ways or one or two things that could have happened that could have really changed our whole family dynamic. And the Lord blessed us through that, of course, thankfully. But I thought about that. You can talk about a lot of things, but when it becomes very personal to you, it kind of places a different perspective on it. And I came through that particular situation with a new sense of urgency because I understood the fact that my decisions from that point on, if things had not gone well, could have been totally different for not only me, but for my children and for everyone around our entire family. So it's important. I felt a greater sense of urgency and importance to look at this particular, um, what I want to say, this particular need that I believe that shows up in all of our lives. The fact of the matter is that right now there's about 10,000 people turning age 65 every day within the United States. That's 10,000 people turning age 65 every day within the United States. One thing I often say is the demographic of the insurance client is changing. The demographic of the population is changing. There's going to be more retirees than there are people working here very shortly. And this is something that has never been seen before in American history. But yet, and still, as we'll see as we go through this particular seminar, people are living longer. So there's a quite a bit of burden and stress financially that's being placed, that's out there. And we have to learn how to mitigate and manage these particular circumstances. Insurance companies, they evolve, or they must evolve, in order to stay in business. Insurance firms as well. And that's why I'm here doing this seminar. When I started some years ago, no one was doing these type of seminars, and the seminars were often rigid. We're in a particular one particular location or facility where they would ask you to come in, maybe pay feed you a dinner or give you some grand prize for you to come in. And that's one style or one way of doing things. And to many, that may be still successful. But as the population and demographic has changed, people have changed and their buying habits have changed. The way that they view information has changed. And this is why we're doing this particular seminar. Hopefully, we'll be able to give you the short version and also the powerful version of information that you're looking for in this particular seminar. So, things, and I'm saying all that to say this: things are changing, things are evolving constantly. And so, this is one particular issue. Okay, we'll get started. That's enough about that. We'll get started into this particular presentation. Listen, there are quite a few issues that we are facing as we look at um, uh, this particular topic. We've got to lay some groundwork. We've got to look at critical illness and the potential damage that critical illness and chronic illness can bring into an individual's life. Very important that we understand, what we're talking about and what we're dealing with. And these numbers have been studied. This is not like it's anything new. These things have been studied for years, and they have really, the law of large numbers is really telling the story over and over. And we've got to be willing to, take a look at that story and take it in and find out what it means to us. Um, Chronic illness, just two chronic illnesses: heart disease and stroke, for example, as you'll see in this particular section of the presentation, are responsible for many deaths still, even in the age of science, even in the age of medicine, the age of remarkable discovery. I mean, just the other day we had a scientist that was able to split the DNA of a particular set of babies' embryos, and they were able to split the DNA to avoid catching HIV. Now we don't know what's going to happen down the line. This particular man's playing God, but we don't know what that's going to mean or anything like that. But what I'm saying is that this is the age of dynamic scientific discovery, but still, heart disease accounts for 1 in 7 deaths in the United States, 366,800 people annually, and it remains the number one cause of death in the United States. Surprisingly enough, medical error is the third leading cause of death in the United States. Medical error. That you go into the hospital to get better, and something happens in that hospital that you don't make it out of there. Something that could have been prevented, whether that's an overdose, whether that's some wrong procedure or anything. That's the third leading cause. But as we look at these things, it's amazing that in the age of scientific discovery, we still yet suffer from chronic illness. We suffer from medical mistakes, all of these type of things. Stroke is another issue that's very, what I want to say, telling. Over the last couple of years, the CDC has reported that the incidence of stroke, especially within the African American, Latino, and minority populations, are on the increase. There's a great deal of what I want to say conversation about that now as to what the causes of that particular increase is, but it has been notable. So here we are, like I said, at the time of scientific discovery. You would think that these diseases and these chronic situations would be going down, but they're actually going up. Stroke is the number one leading cause of long-term disability in the United States, and that yet remains. So stroke is a very serious illness by itself. Now, this is just one chronic disease or chronic disorder, and two, heart disease and stroke. And these are just two chronic disorders that I point out, but there are many others. There's dementia, and then there's others, as we'll look through this particular presentation. So it's very important for us to understand that these things exist. I personally, I've seen young individuals suffer of stroke and debilitating illness. They've changed their occupations. Some can't work at all. Now, some think, oh, well, I'm a servant of the Lord. I don't have to worry about these things. God's not through with me yet. And, all these cliches that we use. Well, just the other day, a pastor friend of mine that has partnered with me and others on many community initiatives and done some great work here in the city, he had a massive stroke. And guess what? He'll never pastor again. And yet he's still living and he's expected to continue to live. But his life has been dramatically changed because now he can't do things for himself. So we can't take things for granted. Things happen in life and we must be prepared. Chronic illness and critical illness can seriously and irreversibly change our lives. This is just a fact. Well, let's look at what some of the experts say. This particular gentleman, Ken Frazier, sat on President Trump's healthcare board until a disagreement came up some time ago in the news. I won't even go into all that. But Ken Frazier noted earlier in January of this year that the real cost of the healthcare system is chronic illness, things like diabetes and Alzheimer's. This is what he noted, that chronic illness is where the money comes in at and where money in the healthcare system is spent taking care of and mitigating the damage that chronic illness brings into our lives. So this is a very important issue. Chronic illness is there and is noted by the professionals in the healthcare industry. Chronic illness is the number one cost associated with healthcare. Chronic illness, and for those of you who don't know, chronic illness can be identified by the individual inability to perform two or more of the 7 common ADLs or activities of daily living. And those activities of daily living are eating, bathing, transferring, continence, dressing, ambulation, and or the ability to remember or dementia or mental stability. In fact, if a person has a life-threatening characteristic, let's say from Alzheimer's or some other form of dementia, where their life is altered as a result, and they cannot be alone because they're either a threat to themselves or a threat to others due to it, because of this mental incapacity or incapability. They are considered to be fully chronically ill, even if they can eat, bathe, transfer, continence, contain themselves, dress, and move around. So dementia is a very serious chronic illness that is a drain on the healthcare system, and not only a drain on healthcare system, but also is a very, what I want to say, draining and taxing experience for any particular family. How many individuals have we seen that have ran off from a nursing home or a care facility only to not come back again or to have their bodies found? Or sometimes even after a search for hours later, they've seen individuals. There's been many, they've been able to go out and save individuals or rescue them and bring them back. Then there's even other situations where some of our family members have placed things on the stove, started cooking, and forgot they were cooking, and went into the other room, and either a fire broke out or smoke started or something happened, and they were unaware totally of what was going on, even while the smoke was billowing, even while the fire was going on. Many people have lost their lives in situations just like that. That is a chronic illness. Alzheimer's, a chronic illness, very dangerous, very persuasive, and pervasive, and needs to be addressed by individuals and families and the healthcare professionals taking care of them. So this is a part of the landscape. Another part, as I alluded to earlier, individuals are living longer. Americans, by far and large, our life expectancy has increased. Even since 1980, the life insurance actuarial rates bear this out. That rates, many companies are offering so many discounted rates. They're always advertising, oh, you can get this for $25 a month, or so much for so many dollars a month. That's because life expectancies as a whole have gone up. Now, the last 2 years, that has been teetering as well, because there's been somewhat of a little decline in the this particular life expectancy, or the age of life expectancy, and purportedly is due to the high use of methamphetamine drugs. Drug overdoses have really done their job so much, and so until it is a national emergency health wise. But still, even with that included, since 1980, life expectancies for both men and women have increased. Very important, and something that we should know. Listen to this: 70% of individuals and 79% of women over age 65 will require some form of long term care services during their lifetimes. Over 40% of individuals will need care in a nursing home for some period of time. Women live longer per capita than men, just generally speaking. Let's go back and we can look at this. Women generally, their life expectancy is about 81.1, whereas men are 76.3. So if when we look at this and we look at longevity, it's a blessing to live longer, but there are different set of circumstances that may appear that we need to be prepared for and need to be able to know how to maneuver. Here's another situation, another issue: financial considerations. If we're chronically ill, where would the money come from? And we'll talk about that in just a second. But I just want to look at that. And I want you to just look, while we're thinking here, look at your savings. Some of you have 401ks. Some of you don't have 401ks. You just have savings. Some of you don't even have a savings yet. And that's quite all right. But let's just look at some of the averages. I mean, many people, I believe it's a commercial that was on not too long ago. The lady said, the reason that I work, at what, I think she was like 80, she was at least 70 something. I think she was in her 80s. But she said the reason why I have to work is so I can pay my medicines, so I can pay my medications, because she was not able to pay the full cost for her medications, and she needed to have income and earnings coming in because there was no place else to draw the money from. Well, that's the same boat that many of us are in. We can't afford to retire. We can't. We have to work. We can't afford to retire. Well, the median savings of individuals earning about 50 grand, $4,000 a month is a good living as far as I'm concerned. But the median savings, the average savings of individuals that's earning that much from coast to coast is about $63,000. 63,000. So most people that are earning, on average, people that are earning $50,000 have a little bit more than 1 year's worth of salary saved somewhere between their savings and retirement accounts and all of that. That's commendable. At least that is something. But we're going to find out that that's wholly inadequate. Listen, Fidelity Investments is interested in this too. They're a big brokerage warehouse and institutional and commercial investing. They found out the average balance of 401ks in 2016 was about $92,500. That's the average 401k balance. I know many individuals who have made plenty of money in their 401k, but I know some other individuals who have lost just about everything in their 401k as well. I had one particular client that was going to take a certain amount out of his 401k down for a down payment on a new home. And Friday night it was okay, but Monday morning, Monday afternoon, that thing was gone. Couldn't do anything with it. Had dropped that fast. According to the National Care Planning Council, the average nursing home stay, listen to this. Now, talking about money, people with money in the bank, 63,000, 92,005 in savings. Okay, but the average stay in the nursing home is about 835 days and at a cost of $200 per day, which is about the rate in Illinois, even a little bit more than that. That cost is about $167,000. So the average, just based on the average stay in a nursing home, which most people that stay in a nursing home begin their stay with either some type of home care or some type of temporary care, or something before they have to go to a nursing home. So the actual cost is sometimes even greater than 167, but just the nursing home stay itself is 167. So that wipes out generally what a person that's earning a good living would have on savings, and also a person who has done fairly well and saved up in their 401k, that wipes that out in a very short period of time. So where will that money come from? Then finally, where will the care come from? Where will the additional help come from? And there's a problem with what's called government intervention. The first thing is that, and most of us are aware of the Medicare program, Medicare Part A, which is a program that kicks in when a person is age 65 and retires. Now, you can receive Medicare before age 65 if you have been on SSI for 2 years. And so you may qualify or be on Medicare Part A or Part B even before age 65, but those are exceptions to the rule. But no matter what, if you're on Medicare, um, Medicare does not cover full time extended health care. Doesn't cover or oversight, doesn't cover the full time extended stay at home. As we'll find out, it covers about 100 days worth of care. But after that benefit is exhausted, Medicare wants to make sure, or especially Medicaid wants to make sure that you are in a facility if you want full time care for your particular illness. That's whether it's rehab or whatever it is. If it's going to go on, you have to go there. And that's where you get into spin down, because Medicaid is the part that's administered by the state. And this is a state social insurance program, but it requires you to be economically poor. And so it will make you spend that $63,000 that you have in your savings. It'll make you spend that 92,000 that you have in your 401k for your own care before it will step up and help you out and pay for care. In other words, you're going to self-insure. You're going to be paying and under the rules. And there are some limited exceptions to everything that I'm saying. However, those exceptions are very limited and specialized. And if you don't qualify, the only time Medicare or Medicaid will get involved is if you give up those assets. Cash assets, including your retirement savings, must be utilized first. Don't dump them off to your family. Don't think about transferring any bank accounts or anything like that. You know why? Because there's a 5-year look back rule as well. And I don't have that in this particular slide, but they will look and determine the assets that you had within the last 5 years. And if you've dumped off assets to try to make yourself qualify for Medicaid or for any particular type of assistance financially, guess what? Not only is that a violation of the law, but they will bring those assets back into your estate and either use the value or the assets themselves. They will take control of them and sell them in order to pay for your care, or tell you to sell them in order to pay for your care first. Now, some of you have been out there and you've taken care of family, and you know what I'm saying is true. Some of you have no clue. You didn't know that. You thought that there was a fail safe out there, and this is just the way it is. Disability insurance does not cover what I'm talking about. healthcare insurance, your ACA plan, or whatever you have, it does not cover what I'm talking about here tonight. Your Medicare supplement, Part A through F, whatever it is, Medicare Part D, does not cover what I am talking about here in this particular presentation. And many individuals had no clue. Okay. So this is very important. And this is exactly what we face. There are issues on every side. Okay. Now let's look a little bit further. There are some ways to address the problem, but we've got to look at the costs. As I said earlier, the Medicare will cover you 100 days of skilled nursing care, but that must be received in a nursing home facility and not at home except by particular exception or exclusion. Then there is non-chronic skilled nursing home care must be preceded by a 3-day hospital stay. In other words, you have to be really sick or in a bad condition to receive the help from the government. One other thing I want to point to before we get into these costs is the fact that nearly 41% of all long-term care is provided by people under age 65, is provided to people under age 65 who need help taking care of themselves due to diseases, disabling chronic conditions, injury, developmental disabilities, and severe mental illness. Now, that's according to a study that Georgetown University put together in 2007. In that same study, you find that the primary age for long-term care, because many of us thought up until this particular point, well, this is something that old people talk about. This is something that old people get together because they're the ones in need. Well, guess what? About 43% of all of those on long-term care are between the ages of 18 and 65. About 43% of all the individuals are under age 65. This is not just an old people thing. And as we can see, and that's why, the nature of the title is not just for the elderly. And in your planning, you're not just planning for yourself if you are elderly, you're planning for your sons and your daughters. Because listen to this, people that are taking care of individuals in this particular situation of long-term care are primarily the caregivers, the younger individuals. And one study says that about 60% of all care given to the elderly or those on long-term care are family members. About 60% are family members. And only 9% are paid professionals. In other words, most of the people taking care of individuals that are receiving extended health care are individuals who are non-paid family members. Now, I want you to think for a minute, it's just exactly what that does to your family. And I know that, you serve mama, you serve daddy, and you do it all over again if you can, and that's good. There's nothing wrong with that, and I'm not talking down against that, but there are some eventualities that we can prepare for and that we should prepare for, and this is one. Every individual should have a conversation with their family members, with their siblings, with their spouse, with other individuals, should have a conversation regarding healthcare and regarding how we're going to take care of this one when this one is sick or ill. It's only wise and it's only prudent. Let me talk just a minute to our church community. For those of you who are listening within the church community, surprisingly, and I know we see a lot of things on TV, but surprisingly, most pastors, most churches don't extend the pastoral benefit program, and even less than that, about 66%, about 30% of churches only extend the program to their pastors for a benefit program. And less than that 30% address the long-term potential healthcare issue either through disability insurance or through long-term or extended healthcare programs. So a very small percentage even do that. So that this is an opportunity here for the church to wise up. We're tired of seeing double anniversary days, an anniversary day or a special fundraising day where there has to be a special offering or collection made for the pastor or the minister who is non-functional, who cannot function because they are chronically ill and they'll never pastor. The church is rolling on, but this one will never be a minister again because they are incapacitated. It's not the best use of God's resources to to raise annual offerings to address that need. You can do that quite adequately through planning and preparation. Okay, so that's, let me get off my little soapbox there for a minute, but let's look at a few ways that we can address the issue. One that's very popular now is called the assisted living facility, and they're very beautiful buildings. I know around my particular town, I looked and see some of these buildings rise up, and they look so nice. But there's a cost to those buildings. I know in Illinois right now, the cost is about $48,000 a year. And in 10 years, that's expected to go up to about $64,000. My goodness gracious. Where do we get these costs from? These averages from Genworth Cost of Care Survey 2018 at genworth.com. If you go out there, Genworth has been keeping track of healthcare costs, and Genworth just happens to be one of the fine companies that Dunamis Insurance and Business Services represents. But Genworth has actually been doing this study since about 2004, and their costs, their predictions have been spot on, right on. Okay. So this estimate of 10-year estimate is not going to be unreasonable. This is an assisted living facility. 48,000. The average savings, if the average savings is 63,000, that's just about gone and 1 year's worth of stay at an assisted living facility. Then there's another place. This is called, or another particular person that could see an individual that does a very good thing going from home to home sometimes. But if you have a full time in home uh, home health aid or home health care aid, the cost in 2018 is about $51,000 in Illinois. That cost is expected to rise to $69,000 in about 10 years. Okay. So we're talking over $5,000 a month, $5,500 a month that's going to be needed over that in just about 10 years. That's a home health care aid. Okay, let's look on a little bit further. Let's look at the nursing home. And I do have a little secret. I'm able to see just about the performance of any nursing home in the United States. If you let me know your zip code and where you are, if you're thinking about a nursing home facility, maybe for family or loved ones, let me know. Give us a call at Dunamis. Email me at dunamis1, Dunamis1 at netzero.com, or call me at 309-648-5351. And we can look up the nursing homes in your particular area and what rating that they are receiving. But I'm looking at a semi-private annual cost for a nursing home for a room. $195 a day, about $70,993. $70,993, about $71,000 per year for a semi-private room. And this is on statewide average in Illinois. Your state may vary. If you're listening to me from another state, from place to place, it may vary. But in Illinois, $71,000. That is a dramatic increase from 20 years ago when I started in the industry. But in 2028, that cost is expected to rise another $25,000 to $95,000 a year for the semi-private room. $262 a day at that particular time. Many of you have long-term care insurance, and we'll talk about that in a minute, that your daily benefit limit was $150. I mean, that was the traditional benefit limit that I sold. $150 a day. That is wholly inadequate. There is still a deficit at $150 a day. And believe me, that deficit, that extra $45 or so adds up over time if you are in a semi-private place looking for help there. Okay. So this is a very real issue, as you can see. Those are the facts. Okay, now we need to transition because I'm good at laying down the case and I'm even better at providing a solution. Believe that because I'm a problem solver. And let's go ahead and let's tackle this problem because traditionally we've tackled the problem through long-term care insurance. That's been no secret. Hold up, let me get the slide right here. As I said, traditionally we've handled the problem through looking at long-term care insurance. And long-term care insurance has brought us to the fact or have given us the understanding, and I have to mess with the slide again, but has given us the understanding that, hey, we can take care of the issue by insuring it. There's a few options that we have. We can use traditional long-term care insurance, or we can self-insure, or we can just wait and see, when it happens. We've talked about the self-insure route. We have to go through spin down. If we wait and see, guess what? More than likely, we're going to go through spin down too, because if you wait and see and you become chronically ill, guess what? You can't get insurance because you're chronically ill. And if you're really waiting with your mouth closed, you're going to have potential family heartache because somebody's going to have to take time off their job in order to really kind of address situations. And that may not be something that anybody wants to do necessarily, or something that anybody just can do. Not that they don't want to, but maybe they just cannot. But there's a few things that we need to point out about traditional long-term care insurance. Now, number one, I'll start at the bottom of this list of four things over on the left side of the screen. Tax deductibility. Traditional long-term care insurance has a tax deductible premium to a certain degree. That premium can be deducted on your income tax return. And so that's always welcome. But those particular policies have to be what's called qualified policies. In other words, they have to be policies that are that pass the government guidelines or requirements. And so you had a set of qualified long-term care plans that are produced. And with those qualified plans, you can receive that tax deductibility portion of the premium up to a certain particular portion or percentage of those premiums. So that's all. That's a good thing. That's a positive. But there's been a few things about long-term care insurance that I have not been excited about. One of them is cost. They're very expensive, especially if there's any health conditions or health issues. Long-term care insurance can be a nightmare. Either it'll be highly rated, or you may not be able to get it at all. Depends upon what type of health condition. I don't want to say that any insurance is different, but long-term care insurance is considered a health type of insurance. So if there's health issues, you've got a little. It's a little bit more stringent there. So also with that is rate increases. Many of the individuals that have long-term care insurance really, hardly ever use that until, it's really due, until something really happens. It's not anything. Long-term care insurance is generally not something that starts and then stops. Generally, once you start using long-term care insurance, you're going to generally use it up unless there's a reversion of health. But even if you don't use it, there are rate increases. It's happened with just about every client that I've had that have received, no matter which company, that have received some double digit rate increases annually just for having the policy. So if the policy is not affordable this year, and then inflation or whatever, things go up and your income remains the same, the cost of living goes up and the income remains the same next year, it might not be affordable the next year either, and that could be a problem. So, long term care insurance rate increases are not anything to look forward to. Then there is the ultimate, what I want to say, nail in the coffin for long term care insurance, which again, it is a viable and good option. However, there's a problem in most cases that there's a use it or lose it attached to long term care insurance. In other words, if you don't use the policy, you just basically get a thank you for being our client and customer, and that's the end of the road. If a person passes away, there's generally no life insurance benefit attached unless those things have been bought by rider. And if they are bought by rider, if there's a cash return, sometimes the premium is double and even triple what it should be. So the cost is very much a problem when you're dealing with long term care insurance. Okay, and without moving my screen anymore, because as you saw earlier, the screen is not too friendly to me, we want to look at the alternative. Here is the alternative. Remember, I was telling you earlier that in the insurance industry has evolved. Well, it has had to evolve and has had to change and adapt to the way people want to do business and to what makes sense doing business. And one of the things that makes sense is price stability. Having a particular price that's able to achieve and that's able to reach without costing me an arm and a leg and without killing me and my family. So, price stability has been a factor that has been very important, and the insurance companies have had to look at in producing products as a benefit, or as a stable part of their portfolio in order to have clients. If your price is not good, basically, you can say whatever you want to say, but if your price is not good, you're not going to be the main one that families go to. Then death benefits. What if you have a policy and you don't use it and the person passes away that is insured? You want a death benefit, or at least a return of premium. You want some way to recapture the funds that are paid. Not that you're glad or happy for any deaths, you're certainly not, but you do want some ability to manage that policy or have that policy meet you at the point of whatever that next new need is. So this generation of policies are multi-use. They are also set up on a couple of different bases. These policies, once you're chronically ill, they can either reimburse you for expenses or pay you a first dollar cash benefit. And that varies by company to company. Now, I want you to know what I'm talking about tonight is just not wholesale in the industry. There's only a handful of companies that do what I'm talking about tonight. And it just so happens that we're contracted with 80% of those companies. And when I say handful, I'm talking about less than 10. So I'm talking about a handful of companies out of all the companies that have developed product to address this particular issue. There's a very small number of them, and only a few of those really do it good. And just so happens that Dunamis Insurance and Business Services is contracted with the best of the best, the cream of the crop in this particular area. Some of these companies will reimburse for expenses. Some of them will pay cash benefits, and you have to know the policy. You can't buy one policy thinking, oh, this is a cash benefit policy. I'll be able to go get X amount of money if we need it for whatever expense. And you go down there and you fill out the form, and they say, where's your invoice or where's your receipts? And you get nothing. That's a reimbursement policy. Cash benefit policy works totally different. And you have to have a professional work with you. That's why I'm here. A professional work with you to navigate you through this. Then there are some other advantages. Generally speaking, there is a tax-free benefit payment for chronic illness under these type of policies and arrangements, and there's also tax-free death benefits for if a person passes away under this particular type of arrangement. And all of these things together will do what? They'll relieve family pressure. No more worried about where the money will come from, whether anybody has to take time off of their job in order to care for mom, dad, or will your children have to stop their lives in order to take care of you? This particular arrangement will eliminate that. Any great parent out there, and I know you're great parents, you want to see your children live without having to worry about taking care of you. This particular arrangement will allow that to happen at the most advantageous cost. And we are the professionals in this particular arrangement. What is this that I'm talking about? Instead of traditional long term care insurance, guess what I'm talking about now? I'm talking about chronic illness life, or this is what I call it, chronic illness life. Don't call the company tomorrow and say, hey, I want that chronic illness life. That doesn't exist. But Dunamis Insurance and Business Services knows the companies that have a life insurance with chronic illness benefits built in that will help you at the time of need. No state intervention, no guessing, family pressure relieved. This is a solution to the problem. Okay. Well, we need to talk a little bit more about this now that I've got you um, interested and excited. First of all, what is chronic illness life, or what I call chronic illness life plus? Well, it is a life insurance policy with a specially designed chronic illness accelerated benefit rider. Traditionally speaking, I remember when the ages of the accelerated benefits came up, most of the time in times past, you buy a life insurance policy. It was only good if somebody died or if it had a cash value, you could go borrow against it and all of that type of thing. And you could do quite a few things that way. But then they started making what's called accelerated benefits. And that said that if the doctor diagnosed you as having 24 months or less to live, then you can come to the insurance company, fill out a form, and you can receive part of that policy face amount. If you bought 100,000, most situations you can get 80% of the policy. You can get up to $80,000 in advance of death, and that's maybe to pay for experimental drugs, medication, spend any way you need to, maybe even dole out for inheritance, or maybe even rearrange or arrange your funeral if you knew that death was imminent. You could do those type of things. Well, those policies, like I said earlier, have adapted themselves. The policies have evolved, and now some of them on the market include a chronic illness benefit, and very fewer of those have a specially designed chronic illness benefit that is designed to address extended stay, extended stay issues or nursing home related health issues. Very specially designed. It's not a run of the mill type product. Now, there's a few advantages. Why would you use life insurance to do this? Well, number one, there's a difference between life insurance underwriting and health insurance underwriting. And guess what? Sometimes what may not be insurable under a health insurance may be, just may be, insurable under a life insurance benefit. That's one thing, and don't tell them you heard it from me, but you heard it here. There's some advantages. Life insurance, and here's some of them I'll name, some additional ones. So underwriting is one advantage, but here's some additional ones. The life insurance and chronic illness benefits are normally received tax-free as well. Insurance premiums are also guaranteed for life. Remember, under the traditional long-term care insurance plan, the insurance rates went up. They could go up annually. There's really no cap. There's no guaranteed maximum. And they will certainly not send you a reduction of rates. I haven't seen a company do that, but out of all the ones that I've sold, but they certainly will send you an increase. But life insurance generally, has a stable premium amount. So the premium is guaranteed never to increase, guaranteed for life to stay exactly the way that it is and where it is. Then we can look at even more advantages. There's all kinds of benefit period arrangements. Now, what is a benefit period? Benefit period is how long you will be receiving your money. Under this particular arrangement, the money is designed to pay you out monthly. So the benefit period can be, as short as 2 years. It could be as long as a lifetime, for as long as you're living. So if you live a lot of years, that's the more benefit. But the more benefit you buy, you said it, I hear you thinking, the more benefit you buy, generally speaking, the higher the premium is. So you can kind of adjust your premium based on the benefit that you wanted. However, there are some companies that actually give you the best deal for a lifetime benefit. Again, that's something you heard from me. We're able to navigate that for you and tell you what's going to be your best point, your best break point. That's why you got to talk to me about this particular opportunity. Also, extended benefits are available. Sometimes you can buy a shortened benefit period, but that benefit period has a rider on there that will extend benefits beyond the benefit period. And that extension is normally done for a much cheaper rate. Oh boy. And that's when it really gets exciting so far as numbers are concerned. Then there's options. As I said before, there's unrestricted cash benefits or there's reimbursement benefit options available on various types of policies. And you have to know what you're dealing with. Then there's multiple funding options. You want to pay monthly, annual, semi-annually, pay a regular premium, or do you just want to pay one time and be finished with it? Well, we can do that with either one of these policies or any one of these policies or companies that we represent. There are multiple options and ways to fund this type of program. So this becomes a very chronic illness life becomes a very powerful solution to the problem of extended health care. Well, there's all kinds of things that we could say. One of the things that needs to happen with this is a complete estate arrangement. These things should happen. Once you combine this with a particular type of trust, and we had a question in the last seminar about the type of trust that we should use in this particular arrangement, and there's many different trusts that can be explored. But one particular arrangement that we have been successful in using and introducing to our clientele has been the irrevocable living trust. And what this is a living trust that's set up, drawn up by a lawyer, a legal representative, and that trust is initially unfunded. And at the time that there is a problem, that trust becomes funded either by Schedule A or by title, by titling an asset to the trust. And there's, speak with your legal advisor on how to do that. But once that irrevocable trust is funded, then those assets are out of your estate. Your 5-year look back period begins. And guess what? You're covered for at least those 5 years by insurance. Sometimes it depends upon the type of policy that you have for even a lifetime. And guess what? You're able to successfully control the affairs of your estate, direct the trust to handle your assets, how according to your wishes specified or outlined in the trust. And guess what? You are in control of your future. So this is just one particular option, one particular way to do things. But the best thing to do at this particular point is to call me and let me review your particular situation. We want to make sure that these situations are addressed in your life and in the life of your loved ones. It's very important. Very important. You to have a review of your goals financially and to have a review of your estate arrangement could make all the difference in the lives of you and your children. Tired of seeing families sometimes under stress themselves has to go under further stress and debt in order to care for loved ones. And as I said, as a father, I don't want that for my children, and I know that you don't want that for your children as well. But we have been actually in the situation where we've had to take care of an elderly family member because that elderly family member got sick. And guess what? We do it all over again if we had to. The question is not about the heart. The question is about the method. And this particular presentation gives you a method to address issues that has not previously, you know, been looked at or addressed the way that we are recommending here tonight. So, again, to summarize, uh, when we look at the problem is a predictable financial outcome, a predictable situation that many of us are either dealing with or have dealt with, that many of us are either going through or have gone through. And there is a problem here in that we can predict certain financial costs associated with the extended health care of ourselves or our family members. Now, these particular methods is one particular method to address this issue. I just happen to think that it's the best, and there's a handful of ways that you can address it. I think that this is one of the best and most sound issues. Somebody said, well, can we just invest a lot of money? Well, if you're really ready to spend that money up, you can. But remember, your investment is not guaranteed. What may be there today may not be there tomorrow. And tomorrow, maybe if you're talking today and everything's well, tomorrow may be when you need this thing to go in effect. So insuring becomes a very important part of managing risk. So can you invest? Yes, you can. Will it be effective? It may or may not be. There is no guarantee. However, we can replace the mystery with a guarantee of a strong, top-rated insurance company that can guarantee X amount of dollars will be there at X amount of time. I'm recommending to my clients no less than $5,000 to $5,500 a month in these type of benefits in order to address the need really from now going into the next 10, 15 years or so. So there's all kinds of other things that can be placed on these policies. That's another question I've got coming through is, um, how can you protect against inflation? Well, you can build in inflationary riders on this type of policy, just like you could build it in on a long-term care policy as well. However, you'll see the pricing for this is dramatically less or different as you compare the two. Yes, I do have comparisons. I can work from memory on this. I recently compared the cost of a long-term care policy and also a chronic illness policy that covered a lifetime benefit, a long-term care policy that covered a 5-year benefit for a 74-year-old client of mine. The long-term care policy premium was over $1,200 a month for that one. I think the lowest one that I could get was about $800 or $700 a month for that particular individual. The Whereas the chronic illness life premium was actually about $400 a month. So dramatically different, dramatically less. And this particular person has the money to be able to address that particular need. So that was not unreasonable for them for the amount that they were looking for at that time. And it covered a lifetime worth of benefits rather than a 5-year period of benefit. So there are some premium differences. There are some premium issues there. But for the most part, when you work with us, we'll work with you on the parameters, setting cost controls, and trying to keep the premium in the range that it needs to be. Now, this is not for the squeamish. So I don't want to give you the impression that this is an insurance giveaway. It's certainly not an insurance giveaway. However, for the needs and for the actual life-saving potential, financially, that will be had as a result of these plans, and also for the cost savings and controls, there is nothing better right now than solving and addressing these needs with chronic illness life insurance. Listen, my time is fleeting. I've got one more question. Hold on. Yeah. AARP, no, AARP does not have any particular long-term care. You would think that they would, wouldn't you? But there is no, they will talk about long-term care companies and of course, give you information, but they do not have long-term care as a benefit for any of their members. In Illinois, there is an elect act, which allows caregivers of families the ability to use their paid time off, such as their sick days and other personal days, in order to care for a loved one, such as a parent, or something like that, or a relative, and still get paid. Right now, in the current law, if you take off for those type of purposes, you lose the day of work and you don't get paid. Well, they're realizing that the best caregivers are the family caregivers in most circumstances. And so the elect act is there. And so that will allow individuals to don't worry about losing their income for the day to do that. Now, the good part about it is that many of these companies have a training benefit as well that they will give to your loved one in order to become a caregiver under these particular chronic illness life policies. So this is what I'm saying. There's a benefit in there, and there's something that happened. If we look at it, if 66% of individuals are family members, and they're taking time off their job to do that, you can actually pay a family member, um, put them in the system, let them go through their training and have that paid for, and they can get on the payroll and be able to take care of their family member if these situations ever come up. So, yes, thank you for that question. That is a possibility and something that we've talked about before. So, you're not out of the water. You're not, on your own in that respect. Those things can happen. There is a training caregiving benefit associated with these policies. As I said, there's a handful of companies that are involved in this. Dunamis just happens to be contracted with a few of the major companies that do this and do this quite well. We'll be going to a conference in January as well with one of the major companies that does this. We've been invited specially to be in attendance at this particular conference talking about these particular concepts. If you're a ministry person or a business owner, you definitely want this as a part of your benefit plan, if nothing else, but for the owner, especially if you're a small business. You want this in as a part of your benefit plan options. You can do a carve out for this if necessary, or if you're a sole proprietor, certainly you pick it up because it's covered under the healthcare rubric, and you'll need to consult a tax advisor. But this is what it is: a life insurance with a chronic illness benefit, and there's all kinds of advantages for having it. All right, all right. All right, so we're a little bit over time here. Thank you for your questions. Thank you for attending. Remember, I am Harvey Burnett. I can be reached at my office at area code 309-648-5351, or you can email me at dunamis1@netzero.com. We're right there on the screen. You see our website as well as our Facebook site. I thank you for your comments. Thank you for taking the time out to be with us this evening. I'm going to have this particular broadcast redone, and it's going to be on YouTube. So I'm going to be posting that out on my personal YouTube account and linking that to our websites as well, so that people will have a good idea of exactly what we're talking about and also the scope of our services. Remember, give Dunamis Insurance and Business Services a call to discuss these very important needs. Don't let it be said too late now. Get in a hurry, and so we can start doing some planning and help you and your family out. All right. Well, thank you very much for your call, or for being here in this seminar. And thank you for the questions that you posed tonight to help me bring in the additional information that was necessary. If you have any questions or comments, don't hesitate to email us, and either on our website or on Facebook, put your questions in the comments section if you come across our advertisement there. So we certainly appreciate it. We wish you God bless you, and thank you for joining us for this seminar.